Welcome to Wellness Waves, a podcast sponsored by the Asian American Pacific Islander Nurses Association of Nevada. We are here to give education to our community to help empower the people. The podcast is in collaboration with the PHLV. Be ready to dive deep with us with our Wellness Waves with AAPNA of Nevada, where we can talk anything about mental, physical, emotional, spiritual, and financial well-being. I am Zara Gayrama Burines, a registered nurse, a nurse educator by heart, a founding member and the president of AAPNA of Nevada. I am also an assistant professor and one of the Caritas leaders of Nevada State University. I am honored to have Ms. Shelly Reyes today, who will be my special guest to talk about our autism, in the community. To introduce her, I have here some special note about who she is. So Shelly is a dedicated nurse, an autism mom, and a visionary founder of a groundbreaking program that aids special needs to children in navigating the hospital experience with ease and comfort. Shelly's unparalleled dedication and innovative approach has earned her program the prestigious honor of being a speaker at global conferences. Shelly embodies passion, expertise, and heartfelt leadership advocating for the special needs in the hospital and in the community. I am honored to please welcome our very own special today, Ms. Shelly Reyes. Hi, Shelly.
Hello. Maraming salamat. Thank you for having me.
Oh, we are so pleased to have you here tonight. It's an honor for us. Can you give us a hint of, more things about you? Who are you as a mom and at the same time as a nurse?
Sure. So my son, Jalen, has autism. He's 19 years old.
Okay.
I'm also a nurse at a pediatric facility, a charge nurse.
Okay.
And I was able to create a program to help kids with autism and special needs go through the hospital experience.
Wow.
So I think that dual perspective of both mom and nurse allowed me to create a program to help other families like my own through a stressful time. The hospital is so scary for all kids.
Yes.
But more so with kids with autism who have sensory needs. Maybe they can't communicate if they're scared, or maybe the environment is too scary.
That's right.
We've educated our staff to be able to help them and allow them to have the best experience, just like every other kid.
That's right. And you know what? Talking about this support, we got a lot of parents out there, and also even my friends, some of our relatives have some autistic child too. They're also looking for some resources in the community. What other things can you give them? Just give them a hint. What are the things that they could do in the community setting?
Oh, of course. So I know that first starting off, the world of autism seems so scary because for many, unless you know someone who has autism or your child or your own, those types of things are kind of, out of the norm. So seeking out help right away is going to completely change the trajectory of your child's future. So I would always start off with your pediatrician.
Okay.
Start off there. If you're having any concerns, and things that might be prompting you as far as indicators for autism, I'd like to go over those just for parents who are worried about that. There are 4 areas where if you have concerns, go see the pediatrician, because then they can refer you to the local regional center to get the support you need. Okay. So as far as autism early on, it can be diagnosed at any age, as early as 18 months. But I think a lot of parents can see different things about their kids because they just know their child, right? Who knows their child better?
As the moms.
As the mom, yes, right? And I think that sometimes you realize, even early on for a baby, an infant, you realize that they're not looking at you. Maybe they lack the eye contact.
Okay.
So that connection they're already missing. And for some parents, they maybe brush it off and they feel that something could be wrong, but they delay it I think they're going to get better. Yeah. Right. But then the kiddo gets a little bit older and maybe it's time for them to talk. And then you'll start to see a lot of delays in their communication. So maybe they're not saying mama or dada. Maybe they're not responding to their name, or maybe if they do speak, they're repeating what you're saying. They're using echolalia, right? Okay. So that's another indicator. So social interaction, speech, right? And then you'll start to see patterns as they progress. And all these milestones that most kids have, they don't meet them. So when you see certain behaviors come up, maybe they're flapping their hands. My son used to do that a lot when he was 2 or 3. When he would get excited, he would flap his hands, right?
Okay.
And before I'd be like, oh, to me, it was him telling me he was excited because at that time he had no words.
That's right.
You know, I didn't think of it as being wrong. That was his way of showing mommy that I'm happy to be here. I'm excited about this Barney song, whatever it may be. But you might see behaviors like that or repetitive movements, right? Or maybe when they're in a certain environment, you might notice that maybe the lights are too bright.
Yeah.
Or maybe the sounds are scaring them a little too much, more than it would for a neurotypical child, right? So those types of things where it seems extreme. And I think as moms and as parents, we get that gut feeling, right? So that can prompt you. And then the last one, for those who maybe they have kids that are a little bit older, you'll see it in the way that they play.
Oh, okay. So they're playing differently?
They might play differently, right? Not wrong, but just in their own way. You might see parallel play versus playing with other kids. And you know how most kids, when they show up at someone's house and they're having a play date, they just jump in with each other and they're excited. Well, you might just see more kids playing side by side. You'll see that. Or maybe even alone, like they're happier being alone. Or maybe even how they're playing, right? Maybe they're, rather than playing with the cars or the planes in the air, they might just spin a propeller or just spin the wheel. So you could see those 4 things. So I would say for parents who are thinking about those things, and maybe if those things trigger, maybe for yourself, hey, maybe I do see that. I would tell your pediatrician.
Okay.
And then you can get an assessment. Some can diagnose, some cannot. But your regional center, it's federally funded. There is one in every city where they can provide the support, number one. And then the vendors who would be insurance approved to help with whether it be speech therapy or behavior therapy or, you know, fun things like equestrian therapy, any types of things that can help grow your child and make it a better life for them, they can help you with that. So I would definitely recommend if a mom's thinking about any of those 4 areas, go seek help.
Yes.
Go get the help that your child needs.
Wow, that's amazing. That's a lot of information I'm just writing. So I was really amazed of these 4 prompters, like, you know, the early age, most probably these are the symptoms that we should be looking at. But I was just wondering, as a mom, it could be like just a denial because, you know, you love your kid and you don't want to do anything of thinking negative about your kids because this is my kid. Do you think that would be a denial part on the part of the mom as well, getting into some help right away?
Right.
Because they have to cover their kid before they could move on.
Right. So I think that is definitely something that many parents experience. And I think more often than not in our culture, we do see it often.
Yeah.
That it might be socially acceptable. Not that it's a bad thing, but I think many parents, I've heard it be something as far as a curse.
Yeah. Yes.
I've heard that from some Filipino communities where it's like it's not accepted as well. And I think it's because maybe the culture might lack the education of it.
Yes.
Maybe they're afraid of it. I mean, and I think in all cultures, no one wants their kid to have a challenge.
Exactly.
So they're always going to be in denial. But one thing I would recommend to a parent is that don't say, okay, my child has autism.
Okay.
You can say my child has autism, but my child has me.
Wow.
In order to be able to accept like who they are, because then you can provide whatever they need. So whether you're scared of it or not, you don't want it maybe. Nobody wants.
Nobody wants it.
It makes it hard. Not that we don't want autism, but we don't want the challenges that we face with it.
Yes.
Right? We love autism. There's many beautiful stories and people who have autism that are doing wonderful things in this world. But I think early on, it's hard for most parents that they need to say, hey, I'm the parent and I was given this child by God to be their mom. I was chosen so I can give them the best life that they deserve. Right. I think that and I see that often, parents who have kids with special needs, they're the most amazing parents. Yes. They're like their champion, their hero. Right. They do everything and anything. But I think once they are able to accept it within themselves, within their family, and get that support and wake up and say, hey, what can we do for them? Then they'll realize, oh my gosh, it's not this horrible world that people think.
It's not. It's not at all.
It's not.
Yeah.
In so many ways, it's such a huge blessing.
That's right.
Yeah. So get the help you need because it's such a disservice if you don't.
I guess so.
Yeah.
Huh? But my question for you, can you tell us a little bit of a success story of autism? Maybe we could encourage all the moms, the relatives out there, that we could give help for them and they could be successful still in the future. Can you give us some like specific story that would really relate to a successful, a kid that becomes successful towards the end, despite of the fact that they were diagnosed having autism?
I actually want to share my personal story.
That would be perfect.
Because I feel like the metric of success really differs between each person.
True.
Right? As
I would
far
agree.
as what they feel like. What's success? Is it being a doctor? Is it having a ginormous house? What does it mean?
To
Right?
them. Mm-hmm.
So for me, and as you're saying that, I remember when we had our first IEP meeting, which is where the school will meet with you and ask.
What is the name of that?
IEP. It's an
IEP.
individual educational plan that most schools will have to offer because it's a federal mandate for most schools.
Okay.
And it's to help every child with a special need hit the goals that they want.
Yes.
So when you first meet with them, they ask you, what are your goals for your child? Like, what do you want for your child?
Okay.
And I just remember sitting there and thinking, because you always have these dreams when your child is born of what they're going to be. Maybe as a mom, you're thinking, do you want them to be maybe a business owner or, a nurse or an astronaut, whatever you may be. And so you have these plans in your head that you built up of what success or what that would look like. And then I think for many families, when the child gets a diagnosis of autism, for some, it feels like a death of that dream.
Yes. It could be.
Because they have built up through pregnancy and then infancy and, all of those things of who their child's going to be. And when they have the diagnosis of autism, they're like, oh my gosh, that's it.
Yeah.
They can't be all the things that I dreamed them to be. And they almost have to mourn that death, which is okay.
Yeah.
To be able to say, hey, my child is not what I expected, but what a beautiful world that it could be.
Yes.
Right. So for my child, my son, Jalen, he actually was a late diagnosis. He was very engaged and had the eye contact and very, so sweet to everyone. And, so for the longest time, we thought he just had a speech delay. So we put him through all the things as far as speech therapy, getting him into preschool and making sure he had the interactions. But he ended up getting a diagnosis at 5 for that. And I remember thinking when they asked us about our goals for him, my main goal was I wanted him to be happy.
That's right. Okay.
As simple as that. I'm like, I understand the goals that you want to hit academically.
Yes.
Or in life skills. But at the end of it all, even the people who are neurotypical and the most successful aren't happy.
True.
So I want through all of this that he's happy, right?
Yes, yeah.
And I am happy to say in my own metric of success that he's 19 now and I get compliment all the time that he's the happiest kid that you'll ever meet. But that's from years and years of therapy, whether it be behavior therapy, speech therapy, occupational therapy, equestrian therapy, music therapy, for him to be able to live in this world, right?
Yes.
That was created for him. And any sort of obstacle that we had, we would be like, if they said, oh, they'll never fly on a plane, oh, they'll never do certain things. Those things we were like, no, we're going to do it. So I think that if you have parents who are champions for your kid,
yes,
who fight for like, no, I'm not going to take a no. You can't tell me no. God will tell me no, what will be. And I think success is when the parent can stand up and accept who their child is and let them live their life to the fullest of who they're supposed to be.
Wow.
Right. I think that in my own success story, if that is helpful in any way.
Oh my gosh,
Yeah.
it's amazing. You just almost made me cry here. But you are one of the champion mom in here. My question is it because you're a nurse that you are so like willing to go through the entire like process of going through? Or is it because you are a mom who thinks that your kid needs the best care ever?
I think with everything, I'm a mom first.
Okay. All right.
Right. I'm a mom first. And I think, you don't know the fierceness of love until you see it through a mom's eyes. Because a mom will do whatever it takes.
Yes.
They will move the earth for their child if they can. So whether you're a nurse or a teacher or a doctor or whatever you are, own that you're a mom first and God gave you that child for a reason. But I think I was blessed to have the background of nursing because then I was able to have purpose in sharing that with other nurses so that kids who come to the hospital can have a good experience. And I think
True.
prior to that, a lot of our kiddos would not have a good experience. And I think a lot of our staff didn't know how to take care of them. So it was like a lose-lose situation, right? And I think in some ways when we would see that a child had a diagnosis of autism, we are automatically accepted, oh, they have this diagnosis. They're going to have a hard time, right? We'll just accept that it is what it is.
Yeah.
So I feel like the expectation was always set so low. So nobody tried even harder. But I think when I was able to share my story,
Yeah.
even though they didn't have a child with autism, they knew me. And so through me, through my son, they're like, okay, I understand now. So I think being able to be the mom that loves their child and to be in a place where I can have purpose and make a change, that's why I wanted to do it. Because I knew my child, he had to go to the hospital a lot.
Yes.
He had Kawasaki's where he required cardiac caths and lab work and clinic visits, like multiple things where I'm like, it doesn't have to be this way.
Yeah.
I actually know a better way that it could be, and let's do this. And so with the support of staff, and most nurses want to give that better care, everybody was on board. And so they understood why to make the changes. They understood why it meant so much to the families. And so before, our families would leave the hospital crying because it was such a horrible experience. And I see more often than not families crying because we get them. And we took care of them and we understood, and they didn't have to wear the hat of mom and teacher and all the different hats that you have to go and fight for your kid. They can just be mom for a day.
Yes.
And we could take care of them. We could foresee their need. We can accommodate the need. So I think that was just me as a mom understanding that. And knowing how much it means to other moms like myself.
Yes.
So,
and I think that's really nice to know to our audience. So you can just imagine this could be done by anybody else. I mean, your motivation, I guess, is to help your kid to be happy for Sheldon. That's exactly the motivation there. But I'm just also happy that we know that nowadays we have now there's evidence-based practices, innovations out there that could help our autistic kids.
Right.
Because as you said, they should not be doing this way or that way. There is a special way that we could deliver the same care, an authentic care to this type of patients.
Right.
Isn't it great?
So our program, and thank you for saying that, our program, we actually got a group together of people across several disciplines.
Okay.
So we brought in our physicians, our surgeons, our anesthesiologists, child life, social work, spiritual support, everybody that we could align with to give that best experience, and they could give their input as well, right? And then we pulled people from the outside, behavior therapists, to make sure that everything that we were doing was evidence-based practice.
There you go. Very good.
Because how do you even do anything in the hospital without it having that accreditation, right?
Yes.
Proven that it works. And so we were through all of that, we created a program. And this program now changed everything. So we utilize it within our department, and it has spread through to the clinics as well as the emergency department, lab, everywhere. And it's had such an impact to our community that now it's left the walls of our hospital, and it's at our zoo. Wow. So the basic concepts of our program are at our local zoo, and which is special to me because we would take our son there often.
Wow.
And we used to have to take him at like a non-busy day.
Okay.
So that we wouldn't have to go through the crowds and all of those, things that could trigger him. Right.
True.
But after bringing it to that same zoo, it's completely changed it where they have accommodations. They have, quiet zones, and they have headphones for kids to use and sensory items that they could use that now families don't have to wait until a quiet day. They can go any day. Any day. And they can make the same memory that every other family makes. So I love that. And I love that we have a run as well where I wanted a day where families can come as they are.
True.
Right.
Mm-hmm.
And it wouldn't be like coming like, oh yeah, my child has autism with any sort of negative annotation. Right.
Yes.
It's more like, hey, come celebrate. Wow. Let's celebrate together who we are, because I wanted to build a community, a tribe of people, right? And so we have this great run that we have every year that has a resource fair and hotcakes for heroes where families can get engaged and connect and network with each other. But I think that if you are thinking of ways to help in your community, hit every discipline, cross every platform that you can, because there's always going to be one mom out there.
Yes.
Who might be hiding.
That's
might be
right.
in denial, that maybe just a conversation with you can change everything.
Yeah.
Can bring light to what they think is a dark situation. I think that that's what the purpose is we're not given a challenge in life
Yeah.
to simmer and sit in it, right?
True.
We're supposed to use it.
Yes, I do agree.
We're not victims. We need to take it to be victorious.
Yes.
Right. And I think that that's what God's plan is for all of us. And I think that that's your goal. If you're listening, what do I do with this? Why did this happen to me? You know what? It didn't happen to you. Right.
Yes. Oh, I just
Yeah.
love this. I love
Yeah.
this conversation. But, you know, as you're talking about the zoo and everything, I was following through. I was imagining with you. I was a ER nurse for 19 years. So basically, I already saw this child life support for pediatric because I was also both ER nurse for both
Right.
the pediatric and the adult side. I saw how this child life support helps
Right.
us nurses. It just changed a lot on the behavior of the patients.
Right.
These are normal kids. How much more for kids who are autistic? So you can just imagine these people when we're starting an IV, they would sing, they would get some bubbles for them. And it was just like amazing.
Right.
We will sing with them. It is just like, and now it's coming through.
Right.
It's really very effective.
So a lot of the concepts that we use within our program is probably really aligned with child life.
Yeah.
And I really wanted our nurses to be able to be equipped with all of those techniques. So we
Wow.
wouldn't have to call anyone,
Okay.
that they could do it themselves. So a lot of our staff, like we have in every pre-op room, there's a toolbox. We call it a toolbox, right? So you can fix
Oh,
anything
okay.
with bubbles and
Yes,
sensory items and those types of distraction things that could help. So
Yep.
we started off with nurses not knowing what to do, being a little bit hesitant and not scared of the child, but scared that they would do something
Wrong. That's right.
and maybe make a bad situation worse, right? So I think learning those things, how to distract, right? And even I think pediatric nurses, I think all nurses know distraction is everything,
Yes,
right?
I am
Being
with
equipped
you.
with ways to help with distraction, I think that'll improve your care as well. But tying up with child life is always super helpful.
Very.
Yeah. Most
very
child life
helpful.
specialists have a background with autism as well.
Yeah.
Yeah.
And I think, so I think every place that we have right now most probably should have this support life because it's very, very effective. So how do you deal with your staff? Do they have to have training in order to take
Right.
care of this special child, or are they just generalists?
So we actually have special training because of our program.
Okay.
Any person who gets hired on, whether they're housekeeping or a physician or whoever, part of our onboarding has that built into it.
Oh.
Because our program is like, if we're going to be a pediatric facility,
Yes.
then we have to be well versed in the fastest growing developmental issue for all children, right?
Yeah.
If you're going to be the best national pediatric facility, you have to know that piece. Right. So everyone who comes through, that's part of onboarding. And then we do a yearly review, re-education to make sure that we're on the same plate. And then I do, different education with ER and day surgery or what areas that are needing any sort of education, we provide that. So it's yearly, quarterly. We make sure everyone knows so that when they see that accommodation needed, they know how to respond. Because truthfully, every child who walks through our doors deserves the best experience.
True. I am with
And
you.
autism is not a reason to settle for anything less. If anything, it's a reason for our staff to pause and step up.
Okay.
And I feel like I've seen that a lot where they're like, oh, they have autism. I know I can do these things. And they get excited, right?
Yes.
Whereas before they're like, oh, they have autism. Where's Shelly? Can we
Where is
switch
she?
patients? Where I'm like, no. So I feel like now when you're armed with the right information and the tools and all the things that you need to give a better experience, I think most nurses will just jump right in, right? And they'll try to give the best experience for sure.
So you just replicated a lot of Shelleys in your workplace, I guess. You're able to multiply a positive ripple effect to your staff.
Right.
And I think it's really great because it's worth it. It's worth it having this experience that every child should have.
Right.
right?
For sure.
They have all this capacity to enjoy like anybody else.
Yeah.
Right? It's just like, I'm just so like happy that people like you are working so hard to make all of these changes in our community. And these are all evidence-based practice.
Thank you.
So as we move along, I guess we would encourage the other hospitals out there, any
Right.
organizations that take care of pediatric or whoever could really like diversify of what they know.
Right.
Because we need it in the society.
For sure. And I think also seeing the flip side of it, you know, of course we want to, have the best customer service and the best
True.
care for every patient. But having all that information and that knowledge on the other end of that, there's less staff injury.
Yes. I
For
guess.
sure. Right. And then there's also less use of medications that are needed because you're able to utilize other things
Yes.
to help with care.
That's
that you're
right.
not having to do those things. Right. So I
Yes.
think on both ends, when you have that knowledge, hey, how can I do better on both ends? Everybody wins.
Yeah.
For sure. Everybody wins. So I think that's another plug for hospitals out there that are wondering, should we do that for a hospital?
Yeah.
Yeah. When I spoke at this convention in Nashville, many facilities don't have this, even pediatric hospitals, right?
Wow.
So they were very interested because they may too know someone. So
True.
my whole goal of this when I first started it was I want to help like that mom in like Idaho
Yes.
or Kentucky that feels like, oh my gosh, no one can help me. That now that there's a way,
There's a way.
there's a way.
If there's a
Yeah.
will, there's a way
If
as
there's
well.
a will, there's a way.
Yeah.
For sure.
And I think with this podcast also, we could reach as many people out there who really need some education about, like autism, because it is not easy, as you said, to be in there and you don't know anything.
Right.
You don't know anything at all. So we're having fun in here. We're learning, but I think we're on the last question that I have today. I would like to ask you what advices that you could give to our moms or to anybody in the community. What are the specific things that they could do straightforward to make this life easier for everyone?
So I think the main thing is get yourself educated.
Yeah. Okay.
Whether you're a mom or you're someone in the community who doesn't have a child with autism, get yourself educated. You'll be surprised. But this is a whole community of people who need help.
That's right.
And so that could be you. If you have maybe a curiosity about it, maybe you could be one that's being called to help and step up. But when you're educated and you have that knowledge, your understanding and your empathy just skyrockets. And I think when you live in a world where people understand others who are facing challenges, have the heart to open up and face all of those challenges, I think it just changes everything. I remember I like to share this story often, even when I do my talks, is, we used to travel a lot with our son, but we had some challenges in the very beginning, and even like getting on an airplane was super hard.
That is true.
But I feel like the people who were on the plane who showed us kindness and acceptance, just that in itself was so helpful. But I think taking that kindness and having action backed with it, if you feel like, hey, there's something that I want to do or I want to help or can someone help me, you can feel all those things, right? But what can you do? I think empower yourself to take action to maybe I'm supposed to do something with this.
There you go.
Right? Maybe I'm supposed to take this, my child, we're going to make something so beautiful with it. Right? We're going to help so many people because of what we know now. All the therapy that we had, all the knowledge that we have, we can make it easier for somebody else. And I think that's the whole point of life, right? Is to share your blessing with others. So
you got it.
Yeah.
You got it. Oh, so our dear listeners out there, it was a lot of information that we dive today. There is like a lot of education and really empowering the public. As I learned, Shelley just shared her own experience as a mom and as a nurse at the same time. We should be doing the same way. What I was hearing today is first that we could do as moms or anyone out there who have some autistic child or whoever witness this in the community. The first that Shelley just mentioned is to be educated. I just love that word. You have to be educated. If you have the right knowledge and the right attitude, of course, you will be empowered to do things the right way. I love that. That is so powerful. So then we, as caregivers, should look at this in the positive way because we could have this ripple effect to other people out there. And then the second time around, once you're educated, then to the moms, you better be proactive with the symptoms that Shelley just shared with us. She mentioned about 4 things: with the eye contact, there's a communication gap, social interaction that's really odd from the rest of the pediatric population, and the normal milestone, they're also in the opposite side. So then if we parents out there, we saw this in our kid, please be humble enough to accept that there is no way that you will just hide this, because we got a lot of resources in the community to help them be in where they should be. Am I right?
Yes, absolutely.
Yeah. So I think what we can do at this time, we are just giving you an education, as I said, to empower everyone. So at least we could, in our own little way, pinch in on how we could make an authentic, effective, and an individualized care for our autistic population. That is so powerful.
Thank you.
Thank you so much for a lot of information
for having
today.
me.
And I learned
Thank
a
you.
lot from you. And from this moment onwards, maybe we'll have another episode to give you more time to explain what would be moving forward.
Okay, thank you. I would
Be
love that.
nice. Yeah.
Maraming
And I will just
salamat.
get back to you. So before I end with you, how can we contact you? If we want to do something like individualized level or in a personal level, how can I connect to you?
You could call me.
Oh, what is your number?
Johan, will you prompt up my number? So you can contact me directly.
Okay. But anyway, we could most probably add it on towards the end.
Okay.
So just in case any
Sure.
email too, maybe the email
Yeah.
could be, because we might have some people outside the US.
Oh,
This
of course.
podcast could go anywhere.
sure. Yeah.
So
Well,
maybe
during
an
our
email.
global conference, there were many countries that were like, "Oh my gosh, we don't have this." So,
That's right.
Yeah, for sure.
Mhm.
Please.
Okay.
Please,
So that
please.
would be nice to our, valued listeners out there. So you hear Shelley, one of the experts. She is a nun and she is a mother and a nurse at the same time, I should say. So I would like to close our episode for today. There's just too much information. It looks like an information overload for us nurses. But it's nice that we now have the knowledge to take care of our autistic population in the community. So I would like to say thank you so much. Maraming salamat, damo na salamat, daghang salamat, and muchas gracias to everyone. Thank you so much for being with us today. And thank you so much, Shelley, to be, one of our special guests today. So in behalf of AAPNA of Divara, we would like to say thank you, be safe, be healthy, do self-care, of course, and till we meet again. As long as we join now here in our wellness waves of AAPNA of Divara, with the help of our PHLV radio, we will be here to serve the community. Thank you so much.